There's big news on the horizon, and it brings with it a wave of relief, hope, and support for millions of older Americans. Congress has just passed a groundbreaking Social Security relief package that could significantly ease the burden on many low-income seniors who are struggling to stay afloat in today's economy. For far too long, retirees and Social Security recipients have had to deal with the growing gap between rising living expenses and stagnant benefits. But that's finally beginning to change. This newly approved plan includes an annual increase of over $2,500 in Social Security benefits, a move aimed specifically at those with limited income, many of whom depend on Social Security as their sole or primary source of income. This update isn't just about numbers, it's about people. It's about the millions of seniors who have spent their lives working, contributing to society, raising families, and building communities, only to find themselves in retirement, worried about how to pay for rent, medicine, groceries, and other basic needs. The increased support comes in the form of monthly benefit boosts, with eligible recipients expected to receive an average of $210 more per month, beginning as early as May, with full rollouts planned by the end of June. This isn't a one-time payment. It's a permanent increase designed to help retirees maintain a more stable, secure lifestyle over the long term. Why this is happening, the reason for this long-awaited move. A combination of inflation, increased healthcare costs, and the realization that standard COLA, cost of living adjustment, increases simply haven't kept pace with reality. Lawmakers and advocacy groups have pushed hard for this change, citing stories from seniors across the country who are forced to make heartbreaking choices between medicine and meals, or between paying the electric bill and getting proper care. The aim of this relief package is to restore dignity and financial stability to millions of seniors who are just trying to live their golden years in peace. Who is eligible? Here's what you need to know about eligibility. Individuals earning less than $22,000 annually will qualify for the full benefit increase. Married couples with a combined income under $33,000 are also eligible. Those with incomes slightly above these limits may still receive partial increases. You must have contributed to the Social Security system for at least 20 years to be considered. Eligibility will be determined automatically using IRS and SSA records. No need to apply manually unless your records are outdated. This measure is aimed at those who need it most: seniors living on fixed incomes, disabled recipients, and those without access to pensions or retirement savings. What to expect? If you qualify, you'll begin to see these increases show up in your monthly benefit payments. No extra application steps required. SSA will send out official notification letters starting mid-April. If you don't receive one by April 15th, you're advised to visit the My Social Security online portal or contact the SSA helpline directly. This increase is designed to be non-disruptive, meaning it won't interfere with your eligibility for other federal assistance programs. That includes Medicaid SNAP, food stamps, Supplemental Security Income, SSI, housing assistance, and other needs-based supports. In fact, this increase will sit alongside your existing benefits, giving you more financial breathing room. How is this funded? Naturally, many are asking, where is this money coming from? And will it put the Social Security Fund at risk? The answer is no. This plan has been carefully crafted to ensure long-term sustainability. The additional funding will be sourced by adjusting tax caps on high-income earners, redirecting certain federal budget allocations, cracking down on waste and fraud within existing federal programs. This balanced approach allows the government to provide targeted relief to low-income recipients without threatening the overall health of the social security system. Why this matters? This isn't just a policy change, it's a moral statement. It sends a message that we, as a nation, value the contributions of our elders, and that we recognize the right of every senior to live with dignity, stability, and peace of mind. Too many seniors have spent their retirement years worrying, budgeting every penny, and feeling forgotten by the system they helped build. This new policy aims to change that, and it's not just seniors who benefit. Families, caregivers, and communities all stand to gain when older adults are given the tools to live healthier, more independent lives. Less stress on seniors means less stress on the healthcare system, fewer emergency interventions. What should you do now? And better mental well-being. If you or someone you love is receiving Social Security, here are some steps to take. Verify your income level to see if you fall within the eligible range. Ensure your contact information is up to date with the SSA so you receive notifications. Create or log into your My Social Security account to track any updates or changes. Reach out to local senior resource centers if you have questions or need assistance understanding the changes. SSA will also be opening hotlines and dedicated support centers to handle questions, provide guidance, and make sure no one is left behind. Final thoughts. This change is more than overdue. It's a step toward justice, and it's just the beginning. Advocacy groups continue to push for further reforms, including expanded Medicare coverage, more housing support, and better mental health resources for seniors. For now, though, this increase marks a major win. A recognition that no one who worked hard their whole life should have to struggle in retirement. So, if you found this update helpful, share it with others, family, friends, or neighbors, because awareness is key. No senior should miss out on the support they deserve simply because they didn't know it was available. Together, let's spread the word and bring some peace of mind back into the lives of our seniors.